Studio. We're pleased to welcome now Sam Creekmore, a member of the Mississippi House of Representatives. He represents District 14, which incorporates Union County. Is that it? Just Union County now?
That's it.
Yeah.
Not all of Union.
Not all of Union. Wow.
Massagill comes into my area.
Well, yeah. So the main city there, New Albany's been thriving. I suspect that's why.
It's growing.
Yeah.
Union
Great sound. Yeah. Serves as the chairman of the Public Health and Human Services Cmte in the Mississippi House. Happy New Year to you, Representative Creekmore. Good to see you, sir. Thanks for coming in.
Well, always fun to visit with you, Gerard.
So, what time we get started today?
Noon. High noon.
Noon o'clock.
Yeah. Yeah. No lunch for legislators today.
That's right. Well, what do you think you'll do today? I mean, it's not much today, right?
No, we'll go let the Senate know and the governor know that we're open for business, and then we'll probably gavel out.
Well, I was just sharing in the last segment, you and I were talking about it off the air, that the governor wasted no time in putting out there in the public his priority, which, of course, is to fully eliminate the income tax. And he's been clear about that for quite some time. That's what he wants to get done. Do you think we're going to see something to accomplish that?
I think so. From the Speaker White, I think he's made it pretty clear, even publicly, that that's one of the first things we're going to bring out early. So, I'm in the public health realm. I'm letting those guys take care of that, but I'm all for eliminating the income tax, and I think it helps us all.
Okay. So when the discussion comes up about, okay, is it an either or, eliminate the income tax or reduce the income tax, and then address and reduce the sales tax on groceries, which seems to be extremely popular in the public. Do you feel like this is an either or? Is it possible to get all the above done?
No, I think we can do both.
Okay.
I do. And I think we responsibly need to do both. If we're going to reduce the income tax, let's include the grocery tax with that.
Well, and as you are well aware, the tax legislation that was passed a couple of years ago, which eliminated the 4% bracket and then it phases in reducing the 5% bracket over 3 years down to 4%, honestly, a lot of folks got taken off of the income tax rolls as part of that process.
They sure did.
But they're still paying full sales tax on groceries.
On groceries, that's right. And for a lot of people, that hurts them. And if we can do away with that affects everybody.
Yeah, everybody buys groceries.
That's right.
Yeah. Well, that should be interesting. I suspect there might be some exchanging going on. That is typically the case. The lieutenant governor seems to be falling in line and is supporting something to do both.
He does, and I just spoke to him briefly last night, but he agrees that it's a responsible thing for us to do because we're in the history of the state of Mississippi financially more stable than any other time in our history. So, he recognized that in a small speech last night to the Medical Association. So
okay, gotcha.
That was
interesting.
I was encouraged.
Yeah, well, that's good. I think that they're certainly moving in the right direction. As they say, the devil is in the details. Does this mean an abrupt termination of the income tax and thus all the revenue associated with it, or are we talking about phasing that in over a period of time automatically, or phasing it in assuming that certain conditions are achieved, certain targets, financial targets, revenue surpluses, something like that?
Right. And I've just been briefed on it one time, but it's an 11-year process.
Okay.
If everything goes
11 years. Okay.
On average, like we've been doing for the past 10 years, with that maybe 2% growth.
Yeah, it'll be interesting to see the state economist projections for fiscal year 26. I noted that the Department of Revenue published its monthly report to show us where we stand yesterday, and we're above, of course. We're below sine die estimates, but we're still producing more revenue than we're spending. So we still are producing a surplus. But it's the corporate income tax that is down rather significantly, rather markedly, but not really sure what the explanation is for that.
I don't understand that one. I'm glad there are people like you that will dig into it, can figure it out.
I'm working on it, honestly. I had a conversation with Senator Josh Harkins. He and I were both kind of scratching our heads looking at the report as soon as it was released. But we'll get into that. All right, let's talk about public health, more inside your realm. What is on the agenda for this legislative session?
Well, one of our priorities on the House side is CON reform. CON's been around since the 60s in our country. In the 70s, it was mandated by the federal government that every state should have it. In the 80s, Ronald Reagan did away with it. And since that point, Mississippi's not done anything but maybe increase the capital expenditures of CON. And now that Republicans have been in power, we still haven't done anything with it. That's got it across the finish line. So we've got a bill that's going to make some reasonable, logical changes to the CON laws in the state of Mississippi. Not going to hurt anybody. Just take some things off that need to be off. Okay. Encourage more competition and save money.
So for the benefit of our audience, CON, Certificate of Need, and this is a process whereby if an organization, an existing organization or a new entity wants to build a hospital, a clinic, add beds, buy certain equipment, bottom line is you got to get permission from the Department of Health to do that. That's the way it works.
And it's an expensive process.
Yes.
You hire an attorney, they fill out the forms, and then the Department of Health requires a fee.
Yes.
So there's just some things like if you wanted to buy an MRI machine, which is pretty common nowadays, that's part of the CON process. Let's remove that.
Yeah.
And one, you're saving money in the buying process, and two, you're making them more available. Well, some of the argument is, well, some of these MRIs, if you buy one used, they're antiquated and they don't give the picture. Well, insurance companies step in and say, we're not going to pay for that antiquated machine because you're going to have another one on down the road. So the free market capitalism takes care of that part of it too.
We don't need the government figuring that out and dictating that. I think that's the idea here. I believe 35 states, if I'm not mistaken, still have
CON.
Right.
And some, but again, ours had not changed.
Right.
And so this is a real attempt at making some logical differences. If you want to remodel your lobby, and it costs over a certain threshold, you got to go through the CON process.
Sure.
That's
crazy.
That's silly.
Yeah. So help us out. Now, last year we had some legislation that would have made a little change to the CON process.
It did. We got
passed
it through the
in
House.
your House.
That's right.
Went over to the Senate. I don't think got it out of committee, right?
No, it did not get out of the committee. But I have invited Senator Bryan to some of our hearings.
Hi, Bryan chairs the Health Committee in the Senate.
That's right. Hank Zuber and I. Representative Zuber from the coast, he and I have had several hearings on CON and many discussions. But there's some like psychiatric care and chemical dependency facilities. We'd like to remove those from CON. That's just common sense. The capital expenditures, they're so low. Right now, I'm in favor of just removing them.
Okay.
And
me too.
Some people want to double it, but let's just take them out of the process. If a hospital wants to repay their parking lot, they don't need to apply for a CON.
That's crazy.
So
I'll say, Representative Creekmore, honestly, I thought once it passed your House and it went down the hall there to the Senate, I felt pretty good about that getting through. I mean, it's sort of got kind of at the 11th hour kiboshed.
It did, and you know how this process works. Of course, we had the education reform and all that, and so all the air got taken out of the room. And as you know, there are certain code sections that throw up flags, and CON, that code section, everybody, when they see it open, everybody wants to weigh in, and there's always this fear that something's going to get added that can really hurt the process.
Yeah, I remember when it failed in committee, and some applause ensued after that from some members of the public attending. That kind of rubbed me the wrong way, honestly. You know, it wasn't anything to applaud about, and it kind of showed you what was sort of driving this thing.
Exactly. In CON, it was established to keep medical costs down. In the state of Mississippi, we have the lowest medical costs in the country. So it's working, so to speak, but it also thwarts innovation. And so we would, it's time to make some CON changes in the state of Mississippi. And the ones that are applauding are the ones that are making money because it protects their business.
It's a protectionist deal is what the policy is, a protectionist policy. Yeah, you're right about that. It's sort of crazy to think about. The idea was if we allow too much supply, the price might go up. I mean, that in New York, I think, is where it originated. Right. And that was the premise behind it. It just defies all economic logic for sure.
It does. And I do believe in some areas in the state of Mississippi it helps, especially in the rural areas.
Yeah. Okay. If you can hang around, we keep talking.
Love
All right,
to.
we got Representative Sam Creekmore in the Element Well studio. We're stepping aside for a break. We'll be right studio. We're having a conversation with Representative Sam Creekmore. He serves as the chairman of the Public Health and Services Committee. So continue the discussion there, which you were telling me on the break, Representative Creekmore, about some form of repeal of the Certificate of Need statutes you think we could see here.
Yeah, well, hospitals, for instance, which you have to have a CON to have a hospital.
Yeah.
And I do agree with that, especially in our rural state.
Okay.
But hospitals can do inpatient dialysis, but they can't provide outpatient dialysis because that's a whole separate CON process. So what I would like to see is that lifted for hospitals only, and because we have hospitals in just about every county. I think there's 9 that don't have them.
Okay.
But if they could provide outpatient dialysis, that would, 1, give them another revenue stream, and 2, give our people in the state of Mississippi who need that treatment another option, make it a little more available to them.
Sure.
So to me, and that's a simple one. It does still protect our current dialysis who have CON in the state. They're not opening up new units, but the current hospitals would be able to offer outpatient.
Yeah. So, and explain that to the audience. Even if a hospital wants to just add beds, right? That requires a CON.
That requires a CON. And look, in our rural areas, CONs do protect our hospitals from competition coming in because their margins are so low, and even many operate at a deficit. So I'm not asking to lift CONs for hospitals, at least not right now, and maybe not anytime soon until we're much more in a better spot financially in public health. But there are, again, certain areas, and like we talked about, Gerard, this could be the catalyst for more, and I hope it is, for more CON reform, but we got to start somewhere. We've not been able to cross the finish line, and I think this is a very logical bill that can help Mississippians and help the public health in the state.
So I think I've read reports that indicate we have the most county hospitals of any other state. So that's a problem as well, is it not, in our healthcare ecosystem? Many of these facilities are still owned, operated by the county.
That is a problem, and of course, the supervisors in many of those cases elect or provide that board. Yeah, and many times at the hospitals that aren't doing well, it's not necessarily the CEO, but the board that makes it up. Yeah. And the CEO follows their direction. So we're looking at perhaps a takeover process where the state would come in, take the board out, and put some new people in to help. And that's got a long way to go. But that's one of the things we're looking at in the legislature.
Well, I was just thinking in terms of maintaining the CON for the rural areas. Wouldn't you agree, though, to a great extent, what we're doing there is sort of protecting these publicly owned facilities?
That is, yes, I would.
So it feels like we need to phase those out, right? Start replacing those with privately owned.
That's right. It would help, and for like a Baptist to come in and purchase the Greenwood Hospital, that would be a great. Although that's a nonprofit, still that they're in it to survive, and so that would be encouraged for sure.
I think that's a discussion that's occurred in the past, has it not?
Oh yeah, and of course
Octibaha as well, right?
Octibaha, I think the supervisors in Octibaha did vote to sell.
I think that's
hospital,
right. Yeah,
and which is a good decision, and that was a business decision that will help all the people.
Yeah, sure. Well, it was just something that I was thinking about, is that sort of difference between in our healthcare ecosystem, certainly in the hospital aspect of it, where you have the not-for-profit publicly owned facilities, and then you have the for-profit privately owned, and that just sort of complicates things, especially when you get into CON.
That's right. But the medical areas that are doing well are mostly in metropolitan areas. Yeah. And so our area here in Jackson, you could probably lift CON from in certain areas, like the coast or the Jackson area, and everything you wouldn't notice a difference. It would still march on.
And I haven't, dug into it, but that's likely because most of their patients or their payer mix is primarily commercial payment.
That's right.
Right.
And you and I have had many conversations on and off the air about the unique situation hospitals are in, thanks to the great Ronald Reagan. But it is right. I mean, they can't turn people away whether they can pay or not. So it's a different business model than,
no other business that I'm aware of in the country.
No.
Is compelled by law to provide service, even though in many cases they know they're not ever going to see a dime out of it.
That's right. So I think you have to make some concessions because of that and the important need hospitals serve to a community.
Okay. Well, let's kind of pivot to something closely related to that, and that's the issue of Medicaid expansion, which we, of course, addressed last year. And I know that's a hot potato topic for sure, but likely we're going to talk about that again.
Oh, absolutely. Yeah, and we should talk about it. We should talk about it every time. And thank you for being part of the process for Medicaid, and you offered significant insight to the legislature. But, in the federal level, things have changed, and we don't know what that's going to look like. So right now, our plan is to let the Trump administration get in place, and let's go talk to them.
Okay.
Let's see what requirements or what they will let us, what our Medicaid expansion would look like that they would approve.
Well, I will share a couple of things that just in my sort of scouring the news snippets and the comments made by those that are coming into the Trump administration. Mehmet Oz, for example, who's Trump's nominee to head CMS, which is where all this policy comes from.
Right.
He and, of course, the Doge brothers of Ramaswamy and Musk they've got Medicaid. You know this on the list for significant reform. It's a $620 billion annual spending object in the federal budget. It's significant. It's 10% of total spending, but when you start looking at a $2 trillion deficit, 620 is a big part of that. And they've actually talked about, you hit on it in the last segment, maybe converting to a block grant model. That would have an impact on our bottom line here in the state.
That it definitely would.
Big time.
And so let's we've tried last year with Medicaid expansion. Let's see what that Trump administration is going to do, and that may change our course on how we approach it. It will.
There's a discussion perhaps of eliminating the enhanced match of 90% for the expansion coverage group. That's been in place since it was enacted 10 years ago, but there's talk about just eliminating that, and each state that has the coverage group, that coverage group is part of their Medicaid program, through expansion would just receive their standard federal match. That would be an issue to us if we were to expand.
Yeah, absolutely.
From a financial perspective, that would be an issue. And then there's talks about the waiver we got a couple of years ago that the governor got. There's talks about reforming that as well.
And imagine you get that additional money from the federal government, and then we're talking about the CON process. That kind of helps grease the wheels on doing away with CON.
Yeah, that's a good point. I agree. With all the more reason to look at that. So I think you're right. I think it's a wait-and-see approach at this point that you don't really know. And then there's the work requirement aspect of this. And then, you got the enhanced subsidies in the exchanges, which were passed in the Inflation Reduction Act under Joe Biden. Those are scheduled to expire at the end of 25. We don't know where that leaves the state with respect to Medicaid program.
Right. So we can spend a lot of time doing Medicaid when we really don't know in what 11 days what it's going to look like, or 26 days, and the administration's in place. And
I'm not sure we're going to know before you guys are out of there this year.
Probably not.
And it might make sense just to put it off until we have clarity.
That's right. I think so. I mean, we're going to talk about it. We're going to keep it as a focal of conversation, but I don't know that we act on it until we know some for sure metrics.
I think that's right. And then we've got RFK coming in.
We do.
And that could sort of upend a lot of the aspects of our government as well. If he gets approved, I think he will likely get confirmed. And he's actually said, I want to put Monsanto and Bayer out of business. That's a little radical. I don't know if that'll occur, but it certainly it could figure into our health policy, could it not, here in Mississippi?
It definitely, talking about conversations, he can put some topics out there that creates conversations. So, yes, it's going to be interesting.
You guys are going to have to be on the watch for everything that happens, I think, with the new administration.
Yeah.
It could be a lot of abrupt changes coming our way, in a good way, hopefully.
Yeah, we'll hope so.
And that'll figure into the sausage making. Representative Sam Creekmore, a member of the Mississippi House of Representatives. He represents Union County, District 14, serves as the chairman of the Public Health and Human Services Committee, has been our guest. We appreciate it. We'll see you again, Representative Creekmore. Thank you, man.
Thank y'all.
We're coming right back.